actually met Dr. David years before Kenzie's diagnosis. He was Kenzie's pediatrician, like right out the gate. He has supported us in phenomenal ways throughout the entire course of treatment, from actually providing the medication support that helped her be as successful as she has been today, to being there for me inpatient whenever I was struggling and helping me navigate the relationships with the oncologist there. And now here we are today. I nominated him because I was in the trenches and he was there with me. And because I truly believe that if it wasn't for how he was able to support Kenzie with CBD throughout treatment, that I don't know that she would be here. And so he always prioritized us and just very much made me not feel alone.
I do hospice palliative care, and I was a general pediatrician with my wife. There was a study a long time ago that came out in pediatrics that said the average pediatrician would see 1.3 children in their career. I think it was 1.3 with a cancer diagnosis. So this was one of our general practice patients with cancer, and it was different. It's different. Obviously, I tend to get pretty close to a lot of my patients with palliative care as well. But when it was Kenzie, I remember my wife saying, "Not our Kenzie. Like, it can't be our Kenzie." She didn't even say our patient Kenzie. It's like our Kenzie, because she was a PSP kid. Our practice was called Pine Street Pediatrics, and it's like it's one of our kids. And she felt us in the trenches because we were in the trenches. Like, I would come home and my wife would say, like, "How's Emily? How's she doing? How's Kenzie doing? Like, how are things going?" And so it became part of that treatment at the same time. There were a few times where you would just shoot a text and be like, "Are you here today?" Because if I was there and I could see her, we would go see her, and even when she was doing, quote, well, whatever well is when you're fighting cancer.
To sum up treatment just very concisely, it was 5 rounds of chemo, a stem cell collection, MIBG therapy, tumor resection surgery, 2 stem cell transplants, 12 fractions of radiation, and 6 months of immunotherapy. That's just frontline. Kenzie is tall and slender and always has been, but she had reached like 32 pounds. There was no way that we couldn't manage things better and help her recover faster so that there were no delays in treatment, because I was wanting to make sure that we stayed on top of that. So we had a conversation then, and then he also supported me toward the end of treatment with trying to make decisions that I felt like I wasn't really getting guidance from our doctors on, as far as enrolling her in clinical trials afterward, because there were a couple to choose from. And so I texted him the information. I said, "Can you look into these for me and just help me make this decision?" And so he researched and read all of the scholarly articles that I sent him and texted me back, and he's like, "Yep, that one looks good." I was like, "Thank you," because nobody would say that. Nobody was, and I understand that the doctors are limited on what they can recommend when you're outside of like what this line of treatment looks like. But I just needed somebody to give me feedback, and he was there again.
You're getting all this information from the oncologist team, you're getting information online, you're getting information from all the support groups. And I remember you saying, like, it's pretty overwhelming, and everybody has all these, I call them doors, like all these different doors that you can open. It's like, well, which door do I walk through? Like, I can see all these, but which one do I walk through? And I remember like how nervous you would get when there were things that were delays.
She was my full-time job. Like I had stopped working. I was inpatient with her every single time, like every step of the way I was there. And so I was going to make sure that she had the greatest chance of survival.
There was no other answer for Mom other than to beat it and win. Like, even when things were bad, she would still find something to be positive. She would still find something to smile about, or whatever. Even on the bad days, we would eventually get a smile somehow.
I mean, when I say in the trenches during treatment, like it has not stopped. he's still the one that's like helping us navigate in real time these stuff, everything that's still coming up.
Hi, Dr. Dave. I thank you very much for giving me my oil and helping me. I'm very healthy now. Thank you very much. I appreciate it.